Hey, quick question, have you ever caught yourself thinking, why don't I want sex anymore, or maybe the opposite, why am I the only one who's always in the mood? You're scrolling at 2 a.m. wondering if your sex drive is broken, or too high. Here's the truth most people never hear, there is no such thing as normal when it comes to libido. In the next 11 minutes, I'm going to show you exactly why your sex drive changes, what's actually normal, and the simple things that can shift it, without shame or weird fixes. Stick around till the end because the number one thing that kills libido for most people might surprise you, and the fix is easier than you think. Let's dive in. What is libido and is yours normal? Libido is just your brain's natural desire for sexual activity. It's not just about wanting sex, it's thoughts, fantasies, and that little spark when you see someone attractive. According to the Mayo Clinic and Cleveland Clinic, there is no magic number. Some people want sex every day. Some want it once a month. Both can be completely healthy. What matters is, are you happy with your level? Is it causing you distress or problems in your relationship? If the answer is yes to those two questions, then yes, your drive is normal for you. Low libido affects up to 1 in 5 men and even more women at some point. It's super common, and it almost always changes over time. You're not broken. You're human. How your libido changes throughout life, the timeline everyone needs to see. Let's look at the natural roller coaster. Teens and 20s, hormones are wild. Testosterone is usually at its highest for guys. For many women, desire starts ramping up in their late 20s. 30s and early 40s, this is actually when a lot of women report their highest desire, more fantasies, more confidence. Guys often stay strong here too, but testosterone starts a slow 1% drop per year after 35. Mid-40s to 50s, perimenopause and menopause hit for women, estrogen and testosterone drop. Vaginal dryness and fatigue can make things feel different. For men, gradual decline continues. 60s and beyond, desire usually lowers for everyone, but many people stay sexually active and satisfied well into their 70s and 80s. Recent large studies show it's non-linear, it doesn't just steadily drop. Life events, stress, and health play a bigger role than age alone. Pregnancy, postpartum, breastfeeding, starting or ending a relationship, even switching birth control, all of these can flip your drive upside down. Totally normal. The 7 real factors that tank or boost your libido. Here are the biggest culprits, backed by Mayo Clinic and Cleveland Clinic data. 1. Stress and mental load, the silent killer. Chronic stress floods your body with cortisol. Your brain literally prioritizes survival over sex. Work, kids, money, it all adds up. Quick win, 10 minutes of daily meditation or a walk can lower cortisol fast. 2. Poor sleep. Less than 7 hours? Your testosterone drops and desire tanks. 1 bad week of sleep can kill your drive. 3. Hormones and life stages. Menstrual cycle, birth control pills, pregnancy, menopause, low testosterone, all shift desire. Women often notice 2 peaks in their cycle, ovulation plus sometimes around period. For medications. Antidepressants, especially SSRIs, blood pressure meds, and some birth control can lower libido as a side effect. Talk to your doctor, there are often alternatives. 5. Physical health. Obesity, diabetes, heart issues, and low vitamin D all reduce blood flow and energy. Even being sedentary hurts. 6. Relationship dynamics. Resentment, lack of emotional connection, or routine boredom can kill desire faster than anything physical. Good news, open communication fixes this more often than you think. 7. Lifestyle, the good stuff. Regular exercise, especially strength training, a diet rich in zinc, healthy fats, and veggies, and cutting back on heavy alcohol all boost libido naturally. Surprise, moderate exercise raises desire, but overtraining can lower it. Balance is key. When should you actually worry? Low or high libido is only a problem if it's distressing to you or your partner. See a doctor if it changed suddenly with no obvious reason. You have other symptoms: fatigue, weight gain/loss, mood swings. It's hurting your relationship or self-esteem. You're not too much or not enough. You deserve to feel good in your body. 5 simple, science-backed ways to feel more in tune with your libido. 1. Track it for 30 days, use a simple note in your phone. Patterns will appear. 2. Move your body daily, 30 minutes of walking or weights works wonders. 3. Prioritize sleep and stress, bed by 10:30 p.m. plus 5-minute breathing before bed. 4. Talk openly, tell your partner, hey, my drive has been lower lately. 80% of couples feel closer after that conversation. 5. Focus on pleasure, not performance, solo or with partner, explore what feels good without pressure. Remember, small consistent changes beat drastic overhauls every time. Your sex drive is not supposed to stay the same forever, it's designed to change. That's not a flaw, it's biology meeting real life. You now know more than 95% of people about what actually controls it. You've got this. If this video made you feel less alone, drop a red heart in the comments and tell me, which factor surprised you the most. Totally anonymous, no judgment. Hit subscribe and turn on notifications. Next week we're covering how to talk about sex without it getting awkward. You don't want to miss it. You deserve to feel confident, connected, and in tune with your body. I'll see you in the next one. Take care.